should thank Dr. Chandak for putting the seed into me and to get this thing out. You know, it was really fun. I thank you, Ashok. Let's begin with the non-verbal communication in the OR. The essential players in the OR is the surgeon, the anesthetist, and the nurses. We often have pathologists coming in the OT or a radiologist coming in the OT, but these are the three main players in the OT with whom we have to really communicate and get along. So the basis of communication lies in the focused message given by one person, which has to be audible and it has to be clear. So now these messages can be verbal or non-verbal, just like this bottle, which is half submerged and half out. So how do we get along? So communication in a healthcare scenario is pretty complex and dynamic. It involves multiple settings. There are many participants and there are unique challenges. So what works best for the patient's interest inside the OT? Let's get into this. So the aspects of non-verbal communication which are useful, which we are going to talk about, are the body movements, the postures, the eye contacts, the paralanguage, the closeness or personal space, the facial expressions, and the physiological changes. Let's go slowly along it. So what are the body movements? They are the kinesics. You know, Twinkle might be better able to really appreciate it. It's the hand gesture, the nodding or shaking of the head. So the three components which I just said, the anesthetist, the surgeon, and the assistant, they are the people who are able to get into it. Yes, and these body movements can substitute what your words are. And the posture also, they signify the sentiments. So how you stand, are your arms crossed? Is your finger pointing towards the man or the machine? The direction how you are leaning, the body orientation, and the openness, it speaks in itself for itself. So your eye contact is absolutely essential. It determines the level of trust and trustworthiness. Winking or rolling one eye is absolutely essential. So facial expressions, as I said, they denote a lot of things. They describe fear, the contempt, disgust, anger, sadness, happiness. So even though what words cannot say, all these facial expressions are still there. And even after that, we can still appreciate a happy surgeon here. Dr. Tanna sir. So facial expressions within the limited space these days between the mask and the cap and the body suits, one can't overemphasize its importance. Smiling, frowning, blinking, which are very hard to control consciously, are the signals which your assistants should grasp. Fear, anger, and happiness are the same throughout the world and are best captured by non-verbal communication. Yes, you can substitute your words by its rightful use. What is paralanguage? It's the tone of the voice, how you are speaking, how is your timbre, how is your pitch. There are also gestures, there is eye contact, there are spatial arrangements, there are patterns of touch even, expressive movements, and silence. It often has a lot of things. Now imagine a case where you can have a picture like this. Your drill bit, your guide wire is broken, your reamer is broken. Rather than suddenly shouting and raising your voice, you can just politely maintain the milieu interior of the OR and use all these paralanguage tools. The language is basically there are many non-lexical conversational sounds. There are grunts, a mix of body action and incomprehensible words directed towards the object. I remember DD from Ganga Hospital saying beep, beep whenever he wants to have an X-ray shoot. Similarly, everyone has his or her own method of communicating what he wants to say without speaking a single word. Your own sign when you need an image of a C-arm. It can be a beep, short, or just a with an intonation. It can also generate humor, formality, respectfulness, and enthusiasm. Now imagine a case where passing a DHS and the femur gets shattered proximally. What else can you do? You have to just use the paralanguage. There are many gestures in the OT, a non-vocal bodily movement intended to express the meaning. They may be articulated with the hands, arms, or body. Movements of the head, face, and eyes are equally important. But remember, the boundary between the language and gesture or verbal or non-verbal communication can be hard to identify. So what are the spatial arrangements? I think Dr. Twinkle had just mentioned about it. This minimizes the talk and frustration. So one of the most essential parts before starting any OT is that the staff should be aware where the surgeon is going to stand, where the monitor has to be. So it has to be ergonomically convenient for the team. So this is absolutely essential. A few moments before you really get into the OT are all which is needed to stress upon the point what Dr. Dabholkar just mentioned. So haptic, this is interesting. This is touching and communication. It can be striking, pushing, pulling, pinching. So you must be wondering why I'm saying this in the OR. Yes, hand-to-hand fighting are forms of communication. We all had for experience keeping our mouth shut. So the reason why I put two instruments up here are that they are often used to signify and to make us pay attention to what your boss is trying to put upon. So many a times we might have had some knuckle marks in the early stages of our residency, but yes, they are an important point of communicating. The message is conveyed, whether it is by touching or by instruments. Physiological changes are also there. So now I'm going to come with the relational coordination, such as sweating or blinking. They are all signs of nervousness. They are almost impossible to control consciously and are a very important indicator of mental stress. So now why I'm putting this scenario here. The OT and the team is a fusion. The surgeon, the anesthetist, and the nurses. So just like you have a musical team where you have a lead singer, you have a guitarist, you have a piano player or a musician, just as they work in a team, the operation theater comprises of one team. And this team is important because it relates to the surgical outcomes, such as lower post-op pain, high post-op functioning, and shorter length of stay. This has all been proven by various references. Remember, your patient is awake and listening while you are operating on him. It's a team effort. They have a shared goals, you have a shared knowledge, and a mutual respect to each other's responsibility. You have to be frequently, timely, accurate, and problem solving rather than a blaming communication. So this is absolutely essential to have a non-verbal communication according to your own frequency. So what is the utility? Messages have shown to be remembered better when non-verbal signals affirm the verbal exchange. So these are all the two things, which go hand in hand. So why non-verbal communication? This has taken efficiency, they have taken to a higher level of quality. There is a job satisfaction as well as work engagement. Indeed, we shouldn't be stressing that there is a psychological safety as well as ability to learn from the error. So many of the things what we have been doing, we have been listening, we have been improvising upon ourselves. So it's a win-win situation. On one hand, there is a patient, and on the other hand, there is a surgical team. The stakeholders are many. You might be having the corporate hospital backing you. You might be having a very VVIP important person whom you're operating, or might be having a big connection. So basically, it's a win-win situation where a non-verbal communication really plays a very important role. So how do we get along with it? The milieu interior, the inside story, what I routinely do and what many of them might be doing. Headphones and music for the patient as per his wishes. So if I have a patient from a village, I'll ask him what type of things he would like to hear. I have a separate headphones in my OT and a small player, a defunct player, which has got certain cassettes. So he gets a headphone and there is a soft music in the OR to mask the sound. So it gives a focus and a better performance. The moment we give a soft music to the patient via headphones, many of the things are masked. But still, be aware that your patient is awake. Your words are very, very important, and so is your team. Utilize a variety of non-verbal communications. Avoid a loose talk. Even though the patient is awake, most of the surgeries are nowadays done in spinal anesthesia or a brachial block. Avoid loose talk. Don't fall into the medico-legal trap. And I thank you very much for your kind attention.